Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everyone, and welcome to episode number 62 of the Better Health Guy blogcast series. Today's guest is Dr. William Shaw, and the topic of the show is toxicity testing. Dr. William Shaw is board certified in the fields of clinical chemistry and toxicology by the American Board of Clinical Chemistry. Before he founded the Great Plains Laboratory, Dr. Shaw worked for the Centers for Disease Control and Prevention, Children's Mercy Hospital, University of Missouri at Kansas City School of Medicine, and Smith Kline Laboratories. He is the author of Biological Treatments for Autism and PDD, originally published in 1998, and Autism Beyond the Basics, published in 2009. He is also a frequent speaker at conferences worldwide. Dr. Shaw is the stepfather of a child with autism and has helped thousands of patients and medical practitioners to successfully improve the lives of people with autism, ADD, ADHD, Alzheimer's disease, arthritis, bipolar disorder, chronic fatigue, depression, fibromyalgia, immune deficiencies, multiple sclerosis, OCD, Parkinson's disease, seizure disorders, tic disorders, Tourette syndrome, and other serious conditions. And now, my interview with Dr. William Shaw. The Great Plains Laboratory has been a leader in functional medicine for many years, probably most well known for their organic acids testing, or what's commonly referred to as the OAT test, which is used by many functional medicine practitioners. In our conversation today, we'll focus on tests that are offered by Great Plains in the realm of toxicity. And I'm personally very honored to have Great Plains founder and functional medicine pioneer, Dr. William Shaw, on the show today. Thanks for being here, Dr. Shaw.
Oh, it's a great pleasure.
Thank you. So how did you decide to become the founder of a lab doing functional medicine testing? Did you or someone in your family have a health challenge that drew you to focus so much of your work in this area?
Yeah, so that's an interesting story. I'm glad that you brought it up. So it wasn't a family member, it was a next door neighbor that first got me into the field out of the research lab and into the integrative medicine field. And it was just a chance occurrence. And I had moved into a new house and was talking to my next door neighbor. And she related to me that her husband had juvenile diabetes. They had two small children, but in essence, he was on the death list. The diabetes was so severe, it was not responding to insulin, was not responding to the dialysis treatment. And they basically told him, you've got maybe 3 months left to live unless you get a kidney transplant. And so he was on the kidney transplant list, but it wasn't looking good. And I had just done some research work on the toxicity of biological detergents, which the most common is fatty acids. And if you ask almost any person in the medical field, what's the most important role of insulin, which this guy had none of, is the first word that usually comes out of their mouth is glucose. And what I had, the other role, which is nearly forgotten by most of the world, is the control of free fatty acids. That in addition to reducing glucose, insulin has a profound role in reducing the quantities of free fatty acids, which are extremely toxic in numerous medical conditions, sepsis, diabetes, pancreatitis, and a list really too long to even talk about. And so since I had done all this research, I said, I'm not sure that this will work, but I think it may. try high doses of niacin, because niacin has the ability to dramatically reduce the amounts of free fatty acids. It has absolutely no effect on glucose, but has a profound effect on reducing the free fatty acids, meaning non-esterified. And, probably 250,000 laboratories throughout the world test glucose, but I don't know that there's a single one that routinely tests free fatty acids. And I said, so what I think is that the free fatty acids are what is destroying your kidneys. What he had a creatinine clearance. A normal creatinine clearance is 125. This individual had a creatinine clearance of 0.5. So he had 99.5% of his kidney function had been lost. So I said, you don't have anything to lose. You may not get this kidney transplant. They said, you're pretty far down on the list. What have you got to lose? And so I told him, start at lower doses, a couple hundred milligrams, and then work yourself up to, say, 2,000 milligrams a day spread throughout the day. And then after I did it, I kind of sweated a little bit because, I started seeing in my mind, at that time I was working for the Center for Disease Control, and I saw the headline, CDC researcher kills next door neighbor.
Yeah.
And I knew it wasn't true, but these were the feedback, the skittishness, of stepping into something outside my realm, so to speak. And so weeks went by, and finally I couldn't stand the suspense anymore. And so, and I knew this person was so sick they could have died any day. And so when I went over there, I was ready to see a very sad face of his wife and mourning, and so I knocked on the door, and then was just standing there, and his wife comes to the door and said, "Oh, it's you. I've been meaning to get across because what you told my husband, it's amazing. It's worked so well. His kidney function, his creatinine clearance had gone all the way back into the normal range from only having half of 1%, and his physician said he was doing so well that they were taking him off the waiting list for a kidney transplant, and that he had smooth sailing. So that was, wow. So when you have like a home run at the first time up to bat, it gets your attention. And Absolutely. So I started looking for other things like that. And as a matter of fact, I hadn't been in that area of research until the last couple of years, and I'm now working on getting back to that original research I had done many years ago, because I think it's something that's needed in the clinical field, is a good test for this phenomena, which right now just doesn't exist.
Wow, that's amazing. Yeah, it's clear that you're doing very meaningful work, and a lot of the tools that you make available through the lab certainly help people and help practitioners in figuring out some of these more complex conditions. I wanted to talk a little bit about the gpl-tox. And so you have talked in the past about this exponential increase in autism, leading to an incidence of about 50% of children in the US being born with autism by the year 2045, and as many as 1 in 10 by 2032, which is not really that far off. And so what role do you feel environmental toxins play in this autism trend? And do you think that many of the same environmental toxins explain the complex chronic illnesses that many adults are seeing today as well?
Absolutely. So with autism, I would say there's two main factors, and I get irritated when I hear people say the cause of autism. I mean, so the groups that have really looked into it, which were the Defeat Autism Now or DAN movement, and the replacement group that maps the medical, pediatric, and special needs group, focus to a great deal on the causes of autism. And I feel that we are very far along in defining the major causes of autism, and toxic chemicals, I would say, are at least 50% of the cause, and the other 50% is the drug acetaminophen. So I think that every few months there are additional papers implicating acetaminophen and toxic chemicals as major causes of autism, but also of other pediatric illnesses like attention deficit and speech abnormalities. So the number is overwhelming. I think the only thing needed is it is a good law firm to take it on and put a stop to it. I mean, it's at that point the scientific proof for these things is overwhelming, and it's really at the stage of political action. Just like it looks like after the last gun incident, it finally has reached a point where people are saying this needs to be the end of the automatic rifles for the mentally ill.
And is the acetaminophen contribution, is that the mother taking acetaminophen during the pregnancy, the child being given acetaminophen, or can it be either of those?
It actually is both. And there's very good documentation for this. The studies, almost every study shows that the connection isn't with any pain medicine. It's specifically for acetaminophen. If they're taking other analgesics, there is no connection. There's no increased incidence. If the mother takes other analgesics during the pregnancy, it has no effect on increases in autism or speech defects or attention deficit. But so it's specific for acetaminophen, both for prenatal as well as postnatal exposure.
And my understanding is that there's a potential connection between these as well. So we have these chemicals and other toxins, but that acetaminophen has an effect on glutathione and also on the body's ability to excrete these toxins. Is that correct?
Absolutely. So acetaminophen is one of the major causes of adult liver failure, where adults go out for parties, they've taken an excess of alcohol, and then afterwards they pop in some Tylenol for the hangover, and the difference between the therapeutic and the toxic level of acetaminophen overlaps. So it is one of the most common causes of adult liver failure, to the point where some nurses that had these adults into their facility said they started joking and calling the drug Dilanol instead of Tylenol.
Wow. And would you say that these toxic overloads also are significant in conditions in adults like chronic fatigue syndrome, fibromyalgia, and many of the other neurological conditions that impact adults as well?
Right. So the toxic chemicals, one of the most important thing is their effect on the brain and the nervous system. And it's because this system uses more energy than any other system in the body, except for perhaps the muscles of a sprinter in the Olympics. But other than which the muscles are only used periodically, the brain is used 24 hours a day, and the nervous system is going 24 hours a day. And so there's a tremendous amount of energy used, and especially in humans, the higher the person is in the phylogenetic tree, the more brain power is needed in order to accomplish the complex things that humans do. So the brain is one of the big targets for both Tylenol and for all these different toxic chemicals. The other big source of problems is in I would say, is in reproduction. Many, many studies are showing sperm counts of men are less than 50% of what they were a couple decades ago. And the same thing is true of animals. There's a study showing that amphibians are in danger of extinction because of the reproductive toxicity of all these toxic chemicals. So if things are affecting animals or reptiles or mammals, there's a very high chance that they're affecting humans as well. And then I would say one of the next most important things is the effect of toxic chemicals on the microbiota. And these are all the microorganisms that are in the GI tract of both humans, animals, but are also in the fields where our crops grow. So there's tremendous amounts of beneficial bacteria that in the fields that we use for farming. And one particular pesticide, or the herbicide glyphosate, which is called Roundup, is one of its biggest problems, is the fact that Roundup is killing preferentially the beneficial bacteria in the environment, in the fields, and causing that beneficial bacteria to be replaced by extremely pathogenic species. This is one of the biggest things. I recently published a case study of triplets with autism in which this was the case. The normal intestinal flora had been replaced with a number of Clostridia species. Clostridia, the species that are ruled, they have some very pathogenic organisms, and these pathogenic organisms then play a toxic role on inhibiting normal neurotransmitters in the brain.
So the gpl-tox test, as I understand it, tests for 172 different chemicals. Currently, it looks for things like organophosphates, phthalates, benzene, xylene, different insecticides, a number of different chemicals that you look for in that. And so I'm wondering, are there certain patterns that you see in which of those chemicals are the more common in terms of the exposures that may lead to health challenges for people?
Yeah, so I would say probably the number one chemical that we see in high amounts, and we plan to do a formal study, so you realize this is just based on my impression. At some time in the near future, we'll have precise numbers for these chemicals, but organophosphates seem to be one of the most problematic chemicals, and it's extremely common. Of course, if people eat organic food, that greatly diminishes their potential exposure. Like in testing myself, I had trace amounts of organophosphates, and I eat only organic food, except for going out to eat at lunchtime. That's the exception in it. That's a big exception. And to my knowledge, the only place that advertises that is Chipotle, saying they're the only one who have all organic food. So I don't go to Chipotle every day. So I had traces, but I did not have high amounts. But I would say it's very common, to the extent that perhaps 25% of all patients tested have organophosphates above the 95th percentile.
Wow. So are there then certain conditions that you see in people that have high toxic burdens based on the gpl-tox? What are the most common conditions that they're dealing with?
So one of the most common conditions is autism. So we have 2-year-olds with autism. Some of them have had organophosphates that were 40 times the upper limit of normal. But other severe diseases like Parkinson's disease or chronic fatigue syndrome, and other types of neurologic diseases, but it's extremely widespread. We also test organophosphates that are not pesticides but are used as flame retardants. And we find that those are associated with infertility in women. So women who've been to their OBGYNs for years, doing every single thing that they know how to do to get pregnant, but are not able to, and it's because they use nail polish that's contaminated with, or so a single application to the toenails and the fingernails can lead to a level of this particular organophosphate called diphenyl phosphate. That's enough to inhibit fertility in women.
Wow, that's amazing. I know you work closely with practitioners that use your lab. So have you been able to draw any conclusions about the type of detoxification strategies that then result in a positive reduction of these toxins on follow-up testing?
Yes, absolutely. So the most effective means of detoxification is, number one, remove exposure to, and a lot of times it means just switching from regular food to an organic diet, changing from your tap water to a purified water, either distilled or reverse osmosis or some other purified water. Number three would be sauna treatment. So in the case of this child with autism who had values of organophosphates that were 40 times the normal level, after doing 3 months of sauna, his values went from 40 times the upper limit of normal to undetected.
Wow.
So to zero. So, I mean, a tremendous decrease. And many of the people, you can actually see the chemical on their skin. And I've got pictures of that where after a certain number of sauna detox reactions, that detoxifications, that there can be a profound elimination through the skin. And then another really good one is glutathione is an excellent for. Glutathione is good for perhaps about half the chemicals that we test for have the ability to be removed by glutathione. And you can tell because a lot of the things we test for are their primary metabolite, which is usually a sulfur complex that was formed via interaction with glutathione. So if it is a sulfated molecule, then all of those chemicals can be removed by the application of glutathione. I usually recommend, say, 500 milligrams a day of the liposomal type glutathione.
Yeah, that's excellent. And it makes me even more excited that I have my sauna heating up for this afternoon right now, in fact. So very good. I know that with the gpl-tox, people can add the test for glyphosate. I have heard people suggest that it's so ubiquitous now in our environment that nearly everyone has some exposure to it. And so I'm curious, does your testing support that conclusion? How common is it?
It's extremely common, and what I would say is around 95% of the population we've tested, I mean, and this is worldwide, have had detectable glyphosate. The other thing that I think is even more important, those people who have values in marked excess of the 95th percentile have extremely terrible diseases. They may have Parkinson's, they may have extreme kidney damage, kidney failure. We've seen a number of cases of autism associated with high amounts of glyphosate. And so with glyphosate, it's unclear to me whether it's the glyphosate itself, which is so toxic, which I still think there's good reason for it, and but also the induction of severe dysbiosis caused by glyphosate is another factor. And I don't know really at this point which one is the biggest factor. But what's amazing is these huge number of deaths in Southeast Asia and in Central America, where they have large farming groups where, tens of thousands of people have died of this kidney disease. And so huge numbers of people are getting dialysis. These are individuals, some of them are in their teens or early 20s, who are dying of kidney failure. And I think the evidence is very strong that the effects of glyphosate appear to be playing a role. And in this particular case, it occurs in areas in which there's a lot of toxic chemicals in the toxic metals in the soil. So glyphosate is a chelating agent that has the tendency to attract toxic metals. So if glyphosate is in the gets into the soil or gets into the groundwater, it'll react and strongly bind these toxic chemicals like arsenic or and other toxic chemicals like that, cadmium or lead. And then when the person ingests glyphosate, they're also ingesting these very toxic heavy metals along with the glyphosate. And so it's a huge thing. It's a real political football. The companies so now it used to be made by a single chemical company, and now the patent's expired, and there's a number of chemical companies that make it. But even today, I think there's setups where the chemical companies are presenting to the Congress about how safe the glyphosate is. Meanwhile, excluding other individuals who have other opinions. And
yeah. And I've had the opportunity to have Stephanie Seneff and Dr. Michelle Perro on the show previously as well. And so they certainly are also feeling similarly to your comments in this realm around glyphosate.
Yeah. And in South America, in Argentina, there was a political decision to convert almost the entire agriculture economy into soybeans produced under the spread of glyphosate, and the huge numbers of infant malformations associated in those areas that have the highest exposure to glyphosate. But as you probably heard from these other individuals, the many other toxic chemicals are used along with glyphosate in the preparation to help it be absorbed better into the plant and so forth. And a lot of these are maybe even more toxic than the glyphosate itself.
Wow. Another thing that you look at in the gpl-tox is the tiglioglycine, which is a marker that can give us some indication around mitochondrial damage resulting from these chemical exposures. So are there certain health conditions where mitochondrial damage and this particular marker seem to be an issue? Is this more commonly an issue in children with autism, for example, or adults with chronic fatigue syndrome? How do we use this indicator?
Yeah, so it's a very useful marker. But it's also very specific. So the tiglioglycine is a marker for the complex 1 of the mitochondria. The mitochondria, it's called the respiratory chain, has, depending on which person you talk to, they claim there's 4 or 5 different complexes in the mitochondria that are associated with converting chemical energy into adenosine triphosphate, or ATP, the main energy currency in the cell. And so if this complex one is affected by these toxic chemicals, you'll have elevated T-glycoside. We also found that in the organic acid test, there was an extremely good marker in succinic acid. So succinic acid is a good marker for mitochondrial complex 2 impairment. And in some individuals, we'll see both markers elevated. In some cases, just the T-glycoside, in some cases, just the succinic acid. And the succinic acid is extremely good for marking the severity of the illness. So people with extreme chemical exposure will have values of succinic acid as elevated as individuals who have a mitochondrial inborn error of metabolism.
Wow.
So extremely high values.
So do these values normalize through the introduction of mitochondrial support in terms of supplements and things of that nature, or is it only through the reduction of the chemicals and toxins that are affecting the mitochondria that we see a positive shift?
So I always advise people to do everything. So in a way, I can't answer that because most of the people who I consult with, whether they're physicians or the patients directly, I advise, getting rid of the source, switching to organic food. And so most of the individuals will opt for taking all approaches simultaneously, and that's the most effective. And when they've done that, we do see a marked reduction in the toxic chemical as well as a normalization of the markers, whether they are the T-glycoside or the succinic acid. And we're working on putting together a scientific paper on the value of these markers.
Yeah, fantastic. This is definitely an exciting and important area for people to consider if they're dealing with a chronic illness. I want to now move on to the GPL mycotox, which really is the thing that I've been really excited to talk with you about. I'm particularly interested after having had my own issues with mold illness and water damage building health-related challenges a couple of times over the past many years. I wanted to first talk a little about the technology in the GPL mycotox. So can you tell us a little about the difference between LCMS and ELISA testing, and how the technologies are different, and then why does the LCMS testing potentially result in a better test?
Yeah, so with the mycotoxins, the most important aspect is accuracy. And I would say the type of testing which we do, which is called the liquid chromatography, MSMS, it means that there are 3 quadrupoles. We use called triple quadrupole mass spectrometry. And using this technique, we take one of the characteristic ions of a particular mycotoxin, and then it's fragmented, forming another secondary ion, which in turn is then fragmented again. And so by using this combination of fragmentation, it's the most specific method available anywhere in the world for accuracy. The difficulty with the ELISA is that many times it may be testing for multiple mycotoxins, which may have similarity. And the similarity can be in just isomers of the mycotoxin, or in some cases it could be cross-reactivity to a different mycotoxin. And then even more important is all immunoassay is subject to non-specific interference. And one of the things that is the one of the most common interferences are these free fatty acids that I talked about in the beginning of the program. They have the ability to cause false elevations of virtually any particular immunoassay, whether it's drugs or thyroid or anything else. And I've published a number of papers on how these what I call biological detergents can have an effect on virtually any immunoassay that's out there. So for all of these reasons, and a lot of times the LCMS also has better sensitivity. So for a whole host of reasons, one of the big problems with immunoassay is eventually you have to replace your one antibody you're using as a reagent for a new one. And when you do that, it's rare to be able to have the same sensitivity or freedom from interference that the first one is. And so in addition to its inherent problems, there's also the issue of being able to have continuity of testing when you have to replace the reagents in the assay.
What are some of the common symptoms that someone could experience that could be a clue for possible mold and or mycotoxin exposure that might clue them into saying, maybe I should go explore the mycotox panel?
Yeah. So it is, I mean, it's very difficult because there's a wide range. There is psychiatric symptoms, depression. There's neurologic conditions like tremors or Parkinson's. There is cancer, is a common factor for some mycotoxins. For example, one of the most common is called ochratoxin A. It's one of the most common mycotoxins in food, but it's also present in the water-damaged buildings as well. Aflatoxins are in many countries in the world, particularly the third world countries. There's a very high incidence of aflatoxin poisoning leading to liver cancer. And it's probably the major cause of liver cancer throughout the world. So these are some of the symptoms, but it can be Joe Brewer, for example, you mentioned before, it did a nice study showing that chronic fatigue syndrome is commonly associated with mycotoxin exposure.
So what is the connection between mold or mycotoxin exposure and an inappropriate inflammatory response?
So I would say one of the most important aspects has been missed until recently in this laboratory, which we found that it is common to be, appears to be fairly common to be colonized. And so with mold or fungus, mold and fungus are interchangeable terms. So the person exposed to mold or fungus, these organisms can invade the body and take up residence in the intestinal tract. And so the individual who has this done is going to be commonly overproducing mycotoxins on a continual basis. So no matter how much clay you take, how much charcoal you take, how much glutathione you take, or perhaps you're using sauna treatment, you're never going to get rid of it because unless you are able to take out the organism inside the body, and most commonly the intestinal tract, although it's also possible one of the other organs is the lungs. There sometimes be these fungus balls where you may have a growth of fungus the size of an orange inside your inside your lungs. And another common spot is in the sinuses. of your nasal passages. So a ENT friend of mine in Mexico found evidence of the mold in a person who's complaining of sinus problems. And so by using the organic acid test, what we found that exposures, a formation of oxalate crystals is a common connection with the colonization by mold. And so in this particular case, the individual had oxalate stones that had formed inside the sinuses. And after treatment with an antifungal drug, he did a repeat X-ray and found that these crystals had completely disappeared. And so what I suspect is that this is something else. This is one of the most important aspects that's really has been missed in the clinical evaluation of mycotoxins, is that they have a profound ability to produce extremely high amounts of these oxalates, which can form deposits in all the tissue in the body. There's evidence they can form in the brain. So the urologist thinks that they only form in the kidney and the cause of kidney stones, which they are. But a lot of people who never had kidney stones, and these oxalates can form in their coronary artery, causing atherosclerosis. They can form in the brain, in the blood-brain barrier, impairing its function. They can form in the thyroid gland, causing abnormal thyroid metabolism. They can form in the liver, in the eyes. So, for example, children with autism frequently have some of the highest amount of oxalates known. And recently, we found extremely good clinical response. So just recently, a Dr. Sidney Baker, who was the founder of Defeat Autism Now, found that he had a child with severe autism, and after doing the organic acid testing, found high oxalates and high amounts of these markers for aspergillus colonization. After treating with an antifungal therapy, the child completely recovered in only 2 weeks, which was the fastest documented recovery from autism ever described. Going from severe autism, not just like mild autism or Asperger, but from severe autism to completely normal in a space of only 2 weeks.
So let's see if I'm understanding correctly. So what we're talking about here is that if you're in a water damaged building, for example, that may have aspergillus and other mold organisms, that there's the potential for those organisms that have been inhaled or breathed in to colonize the sinuses, the gut, and the lungs. And so even if you then leave that water damaged building, you know that your house tested for mold, you leave that environment, you're completely out of the exposure, you may still internal to your body be creating mycotoxins because the organisms are now being carried with you. And it doesn't matter what environment you're in until you reduce or eliminate those mycotoxin producing colonizing organisms, you may not make a lot of progress.
Absolutely. Okay. And so we have found this we found it in fibromyalgia and chronic fatigue, and individuals with bipolar depression, in which the person goes through mood swings, going from feeling extremely or perhaps overly excited to going to be extremely depressed. So this is in addition to a number of individuals with autism. So this was one of the first findings in autism that I had published about 20 years ago, that these fungal metabolites were extremely common in autism, and that by treating with simple antifungal drugs, there could be a marked improvement in the person. But that I think I think this didn't get really appropriate attention, I think, until recently. But I think, again, this is something we need to publish and get out there, that this there's kind of a belief after surveying the literature. There's a number of reported instances in which they test the fungus after autopsy. So, but this is too late. So that there's not enough people checking for these things while the person is sick. And so what I think is, once people are focused on this, they're going to find this is a fairly common problem. And it doesn't matter how much charcoal or clay or glutathione you take, if you don't get rid of the primary source of these resident fungi in your body, you're never going to get well. You might have this for the rest of your life, no matter which building you go into and so forth.
So in that case, the boat is sinking, it's full of water, and the charcoal is essentially the Dixie cup that you're throwing the water out with, where addressing the colonizing organisms producing the mycotoxins is akin to plugging the hole in the boat.
Absolutely. That's a great analogy.
Perfect. So I know there are 7 different mycotoxins that the mycotox panel currently looks at. So what are some of the common molds that we can get a sense kind of indirectly by testing for those mycotoxins? What are the molds that kind of come out in this work as a result of the test?
So we're just preparing a list for release. So it's about 42 different mold species. Plus, we're on the verge of adding another 5 mycotoxins in the near future. Say, in the next week to 1 month, we'll be adding an additional 5. So, so we'll be able to get to virtually all of the more common species of mold, and some of these, of course, are also found in poisonous mushrooms. So in addition to the traditional thing, of course, mushrooms are also a member of the mold family as well. So poisonous mushrooms also have produced some of these mycotoxins as well. But so definitely we'll be looking at things like aspergillus and also in addition to the aspergillus, things like the very toxic Stachybotrys, the molds that produce the immunosuppressive compounds. So many of these are we can. One of the common mold families is the penicillium, and of course the most famous mycotoxin is the world's first antibiotic, penicillin. Of course, is a mycotoxin. It's a toxin produced by mold that kills bacteria. So in addition to harming humans, many of these also have effects on that they may be able to kill viruses or bacteria, as well as causing toxicity to humans. So in essence, a good part of the different mold families are going to be handled with this mycotoxin test, this current version, as well as the new version that will be available very shortly. Another thing is, we priced it so that it is very competitive, because I would go to different scientific conferences, and a common thing was when the speaker would talk about it, they would say that the patient appears to have a problem with mycotoxins, but we didn't run the test because it was so expensive. And now we have a very cost competitive test so that it's affordable to run by most people. And as I mentioned, the best combination is the mycotoxin test paired with organic acids, because with organic acids, you'll be able to see, is the person colonized, and if the person is colonized, they may be able to respond very favorably to antifungal treatment.
I will, in the show notes, I'll put a link to your website where it does describe the 7 mycotoxins that are currently tested for. It talks about potential sources and potential molds that produce those mycotoxins. And so I'll link that for people that really want a little more detail on what is being looked for in the test.
Yeah.
I know there are some practitioners that have also been talking about the role of gliotoxin being clinically relevant in their patients. And so is that one that you are exploring to potentially add in the future?
Right. That should be the one that's available in the next 1 to 4 weeks is the gliotoxin. Gliotoxin is very important because of immune suppression. And so that's one of the big deals with these mycotoxins is they attack the immune system, preventing the individual from fighting off related infections that aren't even due to mold. That may be the flu virus or tuberculosis or any other kind of
or Lyme disease, for example.
Or Lyme disease. That's a good.
And Joe Brewer talked about this at iLads. I attended a lecture of his back in November, and he was making that connection between these mycotoxins affecting the immune system such that then these other organisms in us become more of a problem. I think that's an important piece for people to consider. And oftentimes in people with long-standing Lyme disease, it's very common that they ultimately find a mold source in their home or workplace or school or similar.
Absolutely. Absolutely.
So when someone does the mycotox, should they do something to provoke the excretion of mycotoxins? Do they need to do a sauna? Do they need to do liposomal glutathione? How do we optimize the mycotoxin excretion in the urine, or is that really even something to consider in doing this test?
What I suspect is that it's probably not needed. I would say in the vast majority of our clients who have a visible mold exposure, or one in which, testing of the air has been done with a pump or something like that and come back with a positive, it's extremely rare to find, somebody with negative results across the board. Would these things increase the excretion? Probably. So taking glutathion might be one of the things that might cause increased excretion of these things, or the it can also be sweating, exercise, or just fasting for a half a day or a day prior to the test might also increase the excretion of these things. But at the current time, I would say I don't think they're necessary. I think the test is sensitive enough. I think I would only do something like that in the case that somebody came up with all negatives when they are there's evidence that there is some significant mold exposure in the environment.
Okay.
Another thing to bring out is there is no test that can absolutely distinguish between food or water exposure of mycotoxins and mycotoxins in the air or in the water damaged building. That it has to be done by process of elimination. So if you come up with a positive value, the easiest thing is just to do a physical exam of your house and see, is there one area that's moldy, or is there a smell of mold in the house, and then get remediation people in there and then retest after remediation is done. But of course, in this instance, you also want to make sure with the organic acid test that you don't have colonization, because if you have colonization, the remediation is a good step, but you're still going to have it.
Absolutely. So one of the criticisms, as you pointed out, about urine mycotoxin testing is the question of, I now have a positive result. Is that from a food exposure or an environmental exposure? I know that there are a small number of the mycotoxins currently tested for in the mycotox where it's fairly likely that it is an environmental exposure, but many of the other ones can come from either, as I understand, either
Right.
food or environment. So you mentioned then when you get the results, you have to consider the environment. I would then say you probably also want to consider the foods that someone's eating. And even if they're eating them and they are appropriately excreting those, if they have symptoms, maybe it's not the smartest thing to continue to eat grains and coffee and other things that may be, having exposure to these mycotoxins. Does that not make sense as well?
Absolutely makes sense. I guess the only difficulty is there are so many foods that may have mycotoxin contamination, or indeed there could be actual mold infestation of those foods, that it's very difficult to pinpoint one food. I know there was a case in Texas where I think it was 10 people died due to contaminated corn a while back. And so in cases like that, you can be fairly certain where there's like an extreme amount of contamination. Many of these foods are tested, but usually it's not every batch of the food. They're doing like every 100th bushel that goes through or something like that. And so there's a good chance that you could have contaminated food. And one area that I feel very strongly about is the pet food. I think the evidence is very very strong that perhaps the majority of pet foods are contaminated, and this includes the cheap as well as some of the expensive brands. And if these contain grains of any type, whether it's corn or wheat or rice, they're high instances of contamination. There were documented cases by the employees of when the dog food had expired, it was sent back to the factory, and what they did is they took a razor knife, opened the bags, and then threw it in a bin where it was then thrown into another brand of dog food. So even though there's 47 different brands, it's felt there's like maybe perhaps only 3 companies that produce dog food in the United States. And in essence, they produce many different brands. So there's really no difference between brand 1 and brand 2. And in talking to my veterinarian, the incidence of this cancer called lipomas is extremely common in dogs. And in published papers, it's been found that those lipomas are full of mycotoxins like the ochratoxin A. And there's virtually no oversight by the government. The dog food people put out a bunch of crap. And if people really love their animals, what they should do is just buy cheap hamburger meat for them would be a better way to go than waste their money on contaminated grains.
So one of the things that people may say is, well, many people or most people will have a positive result in a test like this because they're eating and they're probably getting exposure to different things. My understanding is that the percentage of mycotox assays that you guys run, that there is a high percentage of them where they're not considered positive for mycotoxins. Can you talk about that? How common do you get a positive versus a negative?
Yeah, so the most prevalent mycotoxin of all is ochratoxin A. And we find that in a very high percentage of individuals. And And studies have shown that this particular chemical is much higher in the urine of children with autism compared to normal controls. The individual who had this marked response in going from severely autistic to normal in 2 weeks, toxin was the mycotoxin in this particular child. So even though these may be very common, it doesn't mean they're necessarily good for you. But I do agree. I mean, at this point, it is a challenge. This is probably a challenge right now in figuring things out. But I think one of the biggest things that helps is the organic acid test in determining that there is a colonization going on. So what I think is it's the combination of these tests will be able to decipher things even better with this extremely common mycotoxin. The other mycotoxins are not present at nearly the rate. I would say much less, 10 or 20%, whereas ochratoxin, I would say, is at least the majority of samples have some ochratoxin A. Wow. And whereas the other mycotoxins, are much less prevalent, but we found all of them in different people, but there really is a major difference. The big advantage is that we can pick up colonization of ochratoxin A, which is an Aspergillus species, by looking at the markers on the organic acid test.
And is there a correlation between the health of a patient and their mycotoxin results? So if you took a largely healthy versus largely unhealthy group, would the incidence of positives on these mycotoxin panels be higher in the unhealthy population?
I believe there's a significant difference. I want to, we're working on putting together a scientific paper on that, and I think I'd like to let the paper speak for itself, because I'm not 100% sure of your. Okay. It's a very good question, but I'd prefer to do it with using the massive amount of data that we have and put it into percentiles and things like that.
Beautiful. So one of the things when I was looking at mycotox panels is the way that the results are referenced. It shows current range of positive results. And I think some people have looked at that and said, oh, I'm in the range, so I must not have a problem. And my understanding is that in order to be considered negative for a given mycotoxin, you actually need to be below that current range of positive results.
Yes, that's right. Right. So we had very long discussions about how to report results, and in fact, we found that virtually everyone had a small amount of ochratoxin A, but we did not feel. So we decided that below a certain level of all, we were going to consider it negative, since virtually everyone, because the technology is so sensitive that virtually everyone had it. So we decided to make a cutoff. You had to have at least a certain amount to be considered positive. On the other hand, we wanted to make sure that people didn't think, oh, this is on the lower side, so it's not significant, because ochratoxins have significant toxicity. So it is something that will have to be worked out over time. It's not perfect, but I would say no lab test comes right out of the starting gate as a perfect test.
Sure.
If you looked at thyroid testing, there probably been 10,000 revisions on how people do thyroid tests and which markers they use. Do they use T4 or T3 or TSH or free T4? And I would say that, we've got the best product out there as far as accuracy and it will take some time to develop all of these the fine tuning of the assay.
Absolutely. And I'm excited to hear that you guys are continuing to release more mycotoxins. When someone is doing an OAT, what are some of the markers on an OAT test that might lead someone to then want to run the mycotox panel?
Yeah, so there's particular markers. All have the root name furan in them. So if anybody's familiar with the oats, we have them numbered. So their markers 2, 4, and 5 are the ones that have furan compounds that are produced by Aspergillus species. And this information has been out there for nearly 100 years, that these compounds are associated with Aspergillus. And what we found is that after antifungal treatment, these can be completely eradicated. We've had one case of autism, the values were 50 times the upper limit of normal, went from 50 times the upper limit of normal to near zero after antifungal treatment. The individual also had extremely high amounts of oxalates, something like 10 times the normal value of oxalate, and those also normalized after antifungal treatment.
We talked about the impact of toxicity and tiglioglycine on mitochondria, using that marker as an indicator of mitochondrial issues. Is there a connection between mycotoxins and mitochondrial stress that you can connect with the mycotoxin, the OAT, potentially?
Yeah, so we, using the succinic acid, we have seen a relationship between elevated amounts of the mycotoxins and high succinic acid. We've also seen high lactic acid and the marker I just mentioned, oxalates. So these markers seem to be associated directly with the fungus colonization.
So as we start wrapping up here, what are some of the therapeutic interventions that practitioners are exploring to respond to a positive mycotox result?
Yeah, the most common, of course, just like with the toxic chemicals, is remove the source of exposure if you know it. And of course, so anytime the person smells mold or sees mold, or has abnormal symptoms that, like nosebleeds when they never had nosebleeds before, they could consider that they have an environmental source and bring in remediation people to clean up and then retest, but also consider organic acid testing. And if they find good markers indicating colonization, that they use antifungal treatment. We have several cases where the physicians use nystatin, a drug that only targets the gastrointestinal tract, in which the indicators of mold disappeared just after nystatin treatment, which would indicate that the exposure was predominantly the gastrointestinal tract. And I suspect that may be the major source that the lung colonization or colonization of other organs is somewhat less frequent. The fact that a drug, nystatin, which is not absorbed into the body, if it causes these mycotoxins to decline, it must mean that it's only in the gastrointestinal tract. So you can look at these markers. If they normalize after treatment with a drug like nystatin, which is not a systemic drug, then that would indicate their exposure is limited to the GI tract. If it's not, they might have to use other antifungals like diflucan, But there's no reason to think for those who are non-physicians, nutritionists, or chiropractors using the test, it's very highly likely that over-the-counter antifungals may also be successful in this treatment.
Have you been able to determine which binding agents seem to have an effect on mycotoxins once we've kind of taken this colonization piece out of the puzzle? Because I know that's potentially important as well, but are there some binders that are really at the top of your list at this point?
Yeah, so there's quite a, I mean, glutathione is very useful for a number of these. The chlorophyll and chlorophyll derivatives have been very useful. A number of probiotics have shown the ability to attack mold. So using probiotics is something you want to consider.
And is that something like Saccharomyces boulardii, or is that something?
The ones I've seen have, and indeed it might have some, but I've seen lactobacillus species that were tested specifically for that. That doesn't mean that other probiotics might not work, but it was the ones tested have been lactobacilli, but then also the cholestyramine, a prescription drug, helps to prevent enterohepatic circulation of mycotoxins, and then also the clay and charcoal are very useful. The big problem with things like charcoal is that charcoal binds everything, and so charcoal is great if you wanted to use it, say, you're colonized and you want to do antifungal treatment. Well, after that antifungal treatment, those organisms are going to die and release massive amounts of mycotoxin into your body, and so you will have a Herxheimer reaction. So charcoal could be very useful in giving for a few days. But my advice would be not to give it for extended time period, because it can also absorb all your essential vitamins, biotin and B6 and B12 and folate. All of these have heterocyclic rings that will very rapidly be bound to charcoal. And so you could, maybe treat your mycotoxin problem. If you treat it too far, you're going to make the person severely nutritionally deficient, because all your essential elements are being eliminated through the charcoal.
Is the plan for the mycotox to remain a urine assay, or at some point can people send environmental samples looking for mycotoxins with this same technology?
We could do that. We're considering that. We haven't made a decision yet. We're thinking that perhaps it would be easier just to partner with various laboratories that are doing that, and that indeed may be what we do. We just haven't reached a absolute decision on that.
So what are some of the key things that you personally do on a daily basis in support of your own health? That's my final question from every show, and I'm always interested to see what
Yeah. So a big thing with me is fats. So I take both omega-3 and coconut oil on a daily basis. Both have been shown to have a very, very good anti-aging and brain preservation abilities. So I think that's very important. I take methyl B12, methylfolate, B6, biotin. On the other hand, there was evidence that some of the other vitamins may cause you to be methyl deficient. So niacin, for example, is converted to methyl nicotinate, which then would use up your methyl B12 and methylfolate. So I take some of those on an occasional basis, but that's my regular supplementation. So I think the essential fatty acids are very useful. Oh, and one additional one, CDP choline. CDP choline is a nutraceutical. It's a drug in Europe called citicoline, but it's a naturally occurring stuff, and it helps to prevent the toxicity of high amounts of phospholipase that have been seen in Alzheimer's and multiple sclerosis and autism. And that's another supplement that I take on a daily basis. And it's specifically been used for optimizing brain functions for treating people with stroke or memory impairment. So I haven't gotten to that point, and so I don't want to get to that point. So it's used as a preventive measure. And I would say all of these, I would say when I first started taking these, I would say within a week or two, I could notice a significant improvement in my cognitive abilities.
And I would add that you clearly are doing work that is very purposeful and is in line with your passion of helping people through your tests and all of the education work that you do as well. And I think that also probably plays a significant role in our overall health.
Oh, I agree with that. Absolutely. That's good suggestion there.
So this has been super fun. I think of you as a pioneer in this realm. I mean, I've heard Dr. Shaw for years. And so the opportunity to have you on the show today and to really learn about these latest tests that you're working on and that your team is working on in the realm of toxicity. And I certainly am in agreement with you that many of the conditions that people are dealing with today are the result of environmental toxicity and exposure to chemicals and pesticides and mycotoxins and things of that nature. So it's really exciting to have these tools available. I want to thank you for doing everything that you've been doing over the past many years now to help other people, and for taking time today to be here and share with everyone.
Well, thank you very much, Scott. I appreciate your very good interview that you've conducted.
Thank you so much, Dr. Shaw.
Okay, bye now.
To learn more about today's guests, visit GreatPlainsLaboratory.com. That's GreatPlainsLaboratory.com. Thanks for your interest in today's show. If you'd like to follow me on Facebook or Twitter, you can find me there as Better Health Guy. To support the show, please visit betterhealthguy.com/donate. If you'd like to be added to my newsletter, visit betterhealthguy.com/newsletters. And this and other shows can be found on YouTube, iTunes, Google Play, Stitcher, and Spotify.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.